Hello, and welcome to this channel, where we make complex pharmacology topics straightforward and engaging. The quiz today is focusing on pharmacokinetics. This video is a valuable resource for healthcare professionals, medical and pharmacy students, and those preparing for professional exams, including the PEBC in Canada, TCQR exams in Ireland, the NAPLEX in the United States, and the GPhC in the UK. Pharmacokinetics is essential for anyone working with medications, as it deals with how drugs are absorbed, distributed, metabolized, and excreted by the body. By the end of this video, you'll have a stronger grasp of pharmacokinetic principles, improving your understanding of how to select and monitor medications for safe, effective therapy. Quiz instructions. In this video, we'll cover 10 multiple-choice questions centered around pharmacokinetics. Each question has 5 options, and only one is correct. After each question, I'll reveal the answer, explain why it's correct, and discuss why the other options are not. There's also a companion video on this channel that summarizes the main pharmacokinetic concepts, which you may find helpful to review. The link for that video is in the description below. For the best results, pause after each question, try answering it yourself, and then proceed to check your answer and explanation. Let's dive in. Question 1 is as follows. Which of the following parameters primarily determines the half-life of a drug in a single compartment model? Option A, volume of distribution. Option B, clearance. Option C, bioavailability. Option D, maximum plasma concentration. Option E, absorption rate constant. The correct answer is option B, clearance. The explanation is as follows. Clearance is a critical factor in calculating the half-life of a drug, which can be determined using the formula, half-life equals 0.693 multiplied by the volume of distribution divided by clearance. If clearance is high, the half-life is shorter, as the drug is eliminated from the body more quickly. Now, here is explanation for the incorrect options. Option A, which is volume of distribution, is inaccurate because although volume of distribution does influence the half-life, it only does so in combination with clearance. Option C, which is bioavailability, relates to how much of the drug is absorbed and reaches systemic circulation but does not affect half-life directly. Option D, which is maximum plasma concentration, represents the peak concentration of a drug in the blood and is not directly linked to half-life. Option E, which is absorption rate constant, affects the rate at which a drug reaches peak concentration but not its elimination rate. Remember, questions like this may test your ability to differentiate between parameters related to drug absorption and those involved in drug elimination. Question 2 is as follows. In patients with hypoalbuminemia, how would the free fraction of a drug that is typically highly protein-bound be affected? Option A, it would increase. Option B, it would decrease. Option C, it would remain unchanged. Option D, it would depend on hepatic function. Option E, it would be influenced by renal clearance. The correct answer is option A, it would increase. The explanation is as follows. In hypoalbuminemia, the free drug fraction increases because there is less albumin available to bind the drug. A decrease in binding protein leads to a higher concentration of free drug in the blood, potentially increasing drug activity or toxicity. Here is the explanation for the incorrect options. Option B, which says it would decrease, is incorrect because less albumin binding generally results in higher free drug levels. Option C, which says it would remain unchanged, overlooks the significant role of protein binding in drug distribution. Option D, which says it would depend on hepatic function, is irrelevant since the change is due to protein levels, not liver metabolism. Option E, which says it would be influenced by renal clearance, is unrelated to protein binding effects. This question highlights the impact of protein binding on drug distribution and emphasizes the significance of patient-specific factors like hypoalbuminemia. Question 3. Which of the following drugs would likely have a high volume of distribution? Option A, hydrophilic antibiotics. Option B, lipophilic antidepressants. Option C, protein-bound anticoagulants. Option D, ionized diuretics. Option E, short-acting beta blockers. The correct answer is option B, lipophilic antidepressants. The explanation is as follows. Lipophilic antidepressants have a high volume of distribution because their lipophilic, fat-soluble nature allows them to pass through cell membranes and distribute widely throughout body tissues, particularly fatty tissues. Drugs with high lipid solubility typically have higher volumes of distribution due to their tendency to move into body fat, muscle, and other tissues beyond the bloodstream. Let's examine the incorrect options. Option A, hydrophilic antibiotics, is incorrect because these drugs generally stay in the bloodstream and interstitial fluid without extensive tissue distribution, leading to a lower volume of distribution. Option C, protein-bound anticoagulants, is incorrect because high protein binding keeps the drug primarily in the plasma, resulting in a lower distribution volume. Option D, ionized diuretics, is incorrect because ionized, charged, drugs tend to remain in plasma and are less likely to cross cell membranes easily, so they have low volumes of distribution. Option E, short-acting beta blockers, is incorrect because these drugs tend to have lower volumes of distribution because they are generally less lipophilic and distribute mainly within the blood and extracellular fluid. Question 4. A young female patient with a known history of epilepsy is prescribed phenytoin. Over the course of treatment, she begins to experience symptoms of toxicity despite no change in dose. What is the most likely pharmacokinetic reason for this? Option A, decreased hepatic metabolism. Option B, linear dose proportional kinetics. Option C, zero-order elimination kinetics. Option D, increased volume of distribution. Option E, increased renal clearance. The correct answer is option C, zero-order elimination kinetics. The explanation is as follows. Phenytoin exhibits zero-order, saturation, kinetics at therapeutic doses, meaning its metabolism rate becomes constant when enzyme saturation occurs. Once saturation is reached, even small dose increases can cause disproportionately high serum drug levels, leading to toxicity. This is often why phenytoin blood levels need close monitoring, as toxicity can occur unpredictably without dosage adjustments. Why other options are incorrect? Option A, which says decreased hepatic metabolism, is incorrect because while decreased metabolism could lead to toxicity, it is the zero-order kinetics of phenytoin specifically that causes its nonlinear accumulation. Option B, which says linear dose proportional kinetics, is incorrect because phenytoin does not exhibit linear pharmacokinetics. If it did, dose increases would predictably raise blood levels, reducing the risk of toxicity. Option D, which says increased volume of distribution, is incorrect because an increase in distribution volume typically reduces, rather than increases, plasma concentration. Option E, which says increased renal clearance, is incorrect because increased renal clearance would likely lower, rather than raise, the drug level and reduce the risk of toxicity. Question 5. Which of the following factors can significantly increase the half-life of a drug in the body? Option A, increased plasma protein binding. Option B, enhanced renal clearance. Option C, decreased tissue binding. Option D, decreased bioavailability. Option E, increased metabolism. The correct answer is option A, increased plasma protein binding. Explanation is as follows. Increased plasma protein binding reduces the free drug fraction in the blood, which slows down elimination and prolongs half-life. Since only the unbound, free, drug is cleared from the body, more extensive protein binding means the drug persists longer in circulation. Why other options are incorrect? Option B, which says enhanced renal clearance, is incorrect because enhanced clearance would shorten half-life by removing the drug more rapidly. Option C, which says decreased tissue binding, is incorrect because this would likely lead to faster elimination and a shorter half-life. Option D, which says decreased bioavailability, is incorrect because bioavailability impacts absorption rather than elimination, so it does not directly influence half-life. Option E, which says increased metabolism, is incorrect because increased metabolism enhances the body's ability to clear the drug, thus reducing its half-life. Question 6. A 55-year-old patient is prescribed a lipophilic drug with a high volume of distribution. What effect will a low body fat percentage have on this drug? Option A, increased drug clearance. Option B, decreased bioavailability. Option C, reduced distribution. Option D, increased plasma concentration. Option E, shorter half-life. The correct answer is option C, reduced distribution. The explanation is as follows. Lipophilic drugs rely on fat tissue for extensive distribution. A patient with low body fat will have less storage capacity for such drugs, resulting in reduced distribution and potentially higher plasma levels due to less sequestration in fat. Let's see why other options are incorrect. Option A, which says increased drug clearance, is incorrect because distribution changes do not directly affect clearance. Option B, which says decreased bioavailability, is incorrect because bioavailability pertains to absorption and is unaffected by fat levels. Option D, which says increased plasma concentration, is incorrect because while plasma levels may rise due to reduced distribution, this is a secondary effect, not a primary determinant of the impact of low body fat. Option E, which says shorter half-life, is incorrect because half-life is influenced by both clearance and distribution. Lower fat storage does not directly shorten half-life in this context. Question 7. When considering a drug with a narrow therapeutic index, which pharmacokinetic parameter is critical to monitor to avoid toxicity? Option A, bioavailability. Option B, clearance. Option C, volume of distribution. Option D, half-life. Option E, plasma concentration. The correct answer is option E, plasma concentration. The explanation is as follows. Monitoring plasma concentration is essential for narrow therapeutic index drugs, where small changes in concentration can quickly lead to toxicity or subtherapeutic levels. Regular monitoring ensures the drug stays within a safe therapeutic window. Why other options are incorrect? Option A, which says bioavailability, is incorrect because bioavailability affects how much of the drug enters circulation but does not directly monitor the drug's level in the blood. Option B, which says clearance, is incorrect because while clearance helps guide dosing, it's not directly monitored like plasma concentration. Option C, which says volume of distribution, is incorrect because volume of distribution impacts drug distribution but doesn't provide real-time toxicity data. Option D, which says half-life, is incorrect because half-life influences dosing intervals but doesn't indicate current plasma drug levels. Question 8. A drug's clearance rate is best defined as which of the following? Option A. The rate at which a drug is absorbed. Option B. The amount of drug in the plasma over time. Option C. The volume of plasma cleared of the drug per unit time. Option D. The time taken to eliminate half of the drug dose. Option E. The dose needed to achieve therapeutic levels. The correct answer is option C. The volume of plasma cleared of the drug per unit time. The explanation is as follows. Clearance rate specifically refers to the volume of plasma from which the drug is completely removed per unit time. This measurement helps determine dosing schedules to maintain therapeutic levels. Why other options are incorrect? Option A, which says the rate at which a drug is absorbed, is incorrect because absorption rate relates to how quickly the drug enters the bloodstream, not its clearance. Option B, which says the amount of drug in the plasma over time, is incorrect because this describes plasma concentration, not clearance. Option D, which says the time taken to eliminate half of the drug dose, is incorrect because this defines half-life, not clearance. Option E, which says the dose needed to achieve therapeutic levels, is incorrect because dosing requirements are informed by clearance but are not the same as clearance itself. Question 9. A patient with renal impairment is prescribed digoxin. Knowing digoxin is primarily cleared by the kidneys, which adjustment is most appropriate for the pharmacist to make? Option A, increase the loading dose. Option B, increase the dosing frequency. Option C, reduce the maintenance dose. Option D, switch to an intravenous route. Option E, increase the therapeutic range. The correct answer is option C, reduce the maintenance dose. The explanation is as follows. In renal impairment, reducing the maintenance dose helps prevent drug accumulation and toxicity. Digoxin clearance is primarily renal, so impaired kidney function significantly affects its elimination. Why other options are incorrect? Option A, which says increase the loading dose, is incorrect because this risks initial toxicity in renal impairment. Option B, which says increase the dosing frequency, is incorrect because this could exacerbate toxicity. Option D, which says switch to an intravenous route, is incorrect because route change does not address clearance. Option E, which says increase the therapeutic range, is incorrect because safety concerns demand strict therapeutic monitoring. Question 10. If a drug has a high extraction ratio, What would be the primary factor influencing its hepatic clearance? Option A, a plasma protein binding. Option B, hepatic blood flow. Option C, volume of distribution. Option D, renal function. Option E, metabolic enzymes. The correct answer is option B, hepatic blood flow. The explanation is as follows: drugs with high extraction ratios rely on hepatic blood flow for clearance, as clearance depends on the rate at which blood is delivered to the liver rather than enzymatic activity. Why other options are incorrect? Option A, which says plasma protein binding, is incorrect because this affects low extraction drugs more. Option C, which says volume of distribution, is incorrect because this affects drug distribution, not hepatic clearance. Option D, which says renal function, is incorrect because relevant to renal clearance, not hepatic clearance. Option E, which says metabolic enzymes, is incorrect because these are less crucial for high extraction drugs dependent on hepatic blood flow. Further tips for revision. As a form of recap, take note of the following 4 tips to help you tackle similar questions effectively. The first tip is that understanding the relationship between clearance and half-life is crucial for many pharmacokinetic calculations. Remember that half-life is inversely proportional to clearance. The second tip is that recognizing trick words in questions, such as accept or not, can significantly improve accuracy. These words can change the entire meaning of a question, so keep an eye out for them. The third tip is that understanding distribution characteristics of drugs, especially factors like lipophilicity, can guide predictions about a drug's behavior in the body, including volume of distribution and distribution to fat tissue. The fourth tip is that in questions about highly protein-bound drugs or patients with hypoalbuminemia, recall that a decrease in protein binding will increase the free drug fraction, potentially leading to increased effects or side effects. Conclusion. And that wraps up our revision on pharmacokinetics. I hope you found this session helpful for solidifying key concepts for your studies or upcoming exams. For further reading, I recommend resources like Katzung and Trevor's Pharmacology, Rang and Dale's Pharmacology, and the British National Formulary, BNF. If you have any questions or thoughts, feel free to leave a comment below, and don't forget to subscribe for more content like this. You can also follow me on Facebook and on Instagram. Thank you for watching.